I'm Dr. Bryan Curry. I'm a non-invasive cardiology. I practice mainly in Aventura, Florida. I have an office in Aventura, an office in Pembroke Pines, and an office near downtown Miami. My father's a cardiologist, so I got exposed to it at a young age, and my mother was a nurse, and so I knew I wanted to do something scientific and medical, and I wanted to investigate why people get sick and what we could do to make them feel better. I treat hypertension, congestive heart failure. I treat coronary artery disease. I'm a non-invasive cardiologist, so I do stress testing. I monitor the heart rhythm. I treat atrial fibrillation also and other arrhythmias. I see people with prior to surgery if they're at high cardiac risk for surgery. We treat people with heart attacks, people with valvular heart disease. So let's say somebody's feeling short of breath or having their heart racing. My approach is as if I was a patient. I didn't like doctors and was scared to go to the doctor growing up. And I saw the experiences of my grandmother and some of my other relatives if I ever went with them. And even as an adult, after I became a cardiologist, and I saw how some of them were treated. So I like to put people at ease and answer questions so that they're more open. Some patients come in and they're scared that you're going to find something and they don't want to tell you anything. And so you have to pull it out of them. And so I would try to make people relax, try to get the information out in a way that's a little bit casual so that they feel comfortable. At HCA Florida Miami International Cardiology Consultants, we have the most comprehensive cardiology practice. I think we can take care of almost anyone. We take care of people with so many different conditions and so many ages, and we all have different kinds of approaches. So it's a group that is appropriately aggressive. We do things, we want to make sure that people are getting what they need without being overly aggressive.